Hi everyone, in this video we will discuss a critical topic in pathology, cell block, bridging the gap between cytology and histology. Our video will be focused on preparation method, advantages and limitation of plasma thrombin technique. To understand the role of cell block, we must first look at the foundation of cytology. Cytology involves the microscopic examination of individual cells to diagnose disease, particularly malignancy, serving as a rapid and cost-effective screening tool. A central procedure in this field is fine needle aspiration cytology or FNAC, which is a minimally invasive method used to extract cells from masses for evaluation. However, conventional smear often face diagnostic limitation. The primary limitation is a lack of architectural context, which can make it difficult to interpret complex tissue pattern and reach a definitive diagnosis. The cell block is designed to overcome this limitation. Technically, it is the preparation of a solid paraffin-embedded block from the concentrate of cytologic specimen. As seen on this video, it effectively acts as a bridge between cytology and histology. While a standard smear is excellent for assessing individual cell morphology, the cell block preserves many tissue structures such as gland and papillae. The process involves concentrating liquid sample through centrifugation, recovering the sediment, and then processing it exactly like a surgical tissue biopsy. The importance of cell block in modern diagnostic medicine is first, they provide an increased diagnostic yield, often improving accuracy significantly when used alongside conventional smear. Second, they offer superior storage and re-evaluation capability. Unlike liquid sample that degrade over time, paraffin block remains stable for years and can be sectioned multiple times for further review. Finally, they allow for technical standardization using the same staining protocol used in surgical pathology department. Finally, the cell block is essential for advanced diagnostic testing. It provides thin serial sections that reveal architectural patterns like nest and sheet. It is considered the gold standard for immunohistochemistry because it preserves the integrity of cellular protein. Furthermore, in modern oncology, this block provides the high-quality genetic material required for molecular assay, which are essential for selecting targeting cancer therapies.
Next, I will be presenting the overview of cell block preparation method, focusing on various techniques used to preserve cells for diagnostic studies. The plasma thrombin method is commonly used for FNAC, infusion, and body fluids. It's cost-effective and helps preserve tissue structure, make it ideal for immunohistochemistry and molecular studies. However, it doesn't work well with low celularity sample where there are fewer cells to form a clot. For example, it's often used for breast lump or thyroid nodules collected via FNAC. Next, the histogel method is a modified agar used for fluid sample with good celularity. It preserves cell well and is easier to handle than regular agar. However, it can be more expensive. It's commonly used for pleural effusion or peritoneal fluids with good cellular content. Moreover, the gelatin method is simple, inexpensive, and used for low celularity sample. It works well for trapping the cells, but it may shrink during processing, which could affect the quality. It's often used for cerebrospinal fluid, which usually has low celularity. Furthermore, the collodion bag method is used for very fluid sample, such as large effusion or watery body fluids. It helps retain cells from dilute fluid, but it's labor-intensive and requires careful handling. It's often used for peritoneal fluid in abdominal cancer, where the sample is highly dilute. Last but not least, automated methods are used in high-volume labs for fast, consistent results. They are perfect for labs with many samples, but they require expensive equipment. During cytology or bronchoalveolar lavage, samples are often processed using automated systems in high-volume labs. Next, when choosing a method, we consider the sample type, whether it has high or low celerity. For example, the upper image represents a low celerity FNAC sample, whereas the lower image represents a high celerity FNAC sample. Then, we need to consider the laboratory resources available and the need for specialized tests like immunohistochemistry or molecular analysis. All in all, the plasma thrombin method is the most commonly used nowadays because it's cost-effective, simple, and helps preserve tissue structure. Now, let's dive deeper into the plasma thrombin method and explore its process and benefits.
Next, I will be explaining on the plasma thrombin technique. The principle utilizes the function of plasma and thrombin, where the plasma containing the coagulation factor will convert the prothrombin to thrombin that will lead to the conversion of fibrinogen in the plasma also to fibrin network. The fibrin will capture the loose cell and create a solid component for cell block preparation. For the procedure, first the sample is centrifuged for 5 minutes at 30,000 rpm. This will form a supernatant and sediment containing the cell required. The supernatant is discarded, leaving only the sediments. Add 2 to 3 drops of plasma into the tube containing the sediment and mix it gently using a wooden applicator. Then add 2 to 3 drops of thrombin and mix it well. This will form clots of the cell containing in the sediment, and then the clot is transferred to be prepared for cell block. For sample collection, this technique can be applied for any type of effusion sample like fine needle aspiration and body fluid sample. For equipment and reagent used in this technique, it only requires 10% of buffer formalin, tissue cassette to hold the clot, thrombin, pool plasma, and lastly applicator stick if required.
Next, for the advantage plasma thrombin cell block, first, the plasma thrombin cell block method is highly regarded for its superior diagnostic performance in cytopathology. By utilizing the collection medium such as Roswell Park Memorial Institute, or known as RPMI, or formalin instead of the traditional saline, this technique will ensure the better cell preparation. One of its critical advantages is the maintenance of tissue architecture, which allows the resulting section to closely resemble the hematocrit. Let's see in the left side for versatility and scope. It will make it suitable for gynecology and non-gynecology specimen. It will also yield compatible with multiple serous section, and it will be effective for both high and low resources setting. While it is generally reliable, some limitations exist, such as the potential for unpredictable clotting time or uneven cell concentration when using the expired plasma. Then, for the right side, the plasma thrombin cell block is an ideal substrate for advanced ancillary and last but not least, for laboratory efficiency, it is widely recognized as the most common home brew method for the cell block preparation due to its high efficiency and easy of use in the laboratory. It is highly regarded for its simplicity as the preparation process is straightforward and does not require the complex automated system. This method also exceptionally cost-effective, largely because it can utilize its expensive or even expired blood bank plasma.
Next, I will discuss the limitations and challenges of the plasma thrombin cell block technique. This limitation can be divided into 4 main categories: sample-related challenges, technical limitation, diagnostic limitation, and laboratory challenges. First, I will talk about the sample-related challenges. The quality of FNAC specimen plays an important role in the success of this technique. Plasma thrombin cell block preparation is often considered cost-effective because it uses expired blood bank plasma. However, expired plasma may show variable clotting efficiency. This means that clot formation may not always be consistent, which can affect the overall quality of the cell block. In addition, FNAC sample often contains scant celerity. When the number of cells is low, the resulting cell block may be poorly formed and provide limited diagnostic material.
This is especially challenging in small or deep-seated lesions, where obtaining adequate cellular yield is difficult. As a result, sample-related issues can already limit the diagnostic value at an early stage. Next, I will move on to technical limitations. One major technical issue is variability in clotting ability. Differences in plasma quality and thrombin activity can lead to unpredictable clot formation time and inconsistent clot size. This makes it difficult to standardize the technique between different laboratories. Furthermore, the cellular palette may appear well congealed on gross examination but can remain friable. Because of this fragility, cell loss may occur during transfer, handling, or formalin fixation. This negatively affects cell preservation and the integrity of the cell block. This technical problem then lead to diagnostic limitation. One important concern is potential DNA contamination from plasma, which may interfere with molecular testing. This is particularly significant when molecular studies are required for diagnosis or treatment planning. Additionally, variable cellular preservation and uneven cell distribution within the clot may limit architectural assessment. This can also reduce the reliability of immunohistochemical staining. As a result, diagnostic confidence may be reduced in certain cases. Lastly, I will discuss the laboratory challenges. The plasma thrombin cell block technique is slightly cumbersome and labor-intensive because it involves multiple preparation steps. This is in contrast to alternative methods such as histogel and agar cell block technique, which generally require fewer handling steps. Moreover, this technique is operator-dependent. This means that the quality of the final cell block depends heavily on the experience and skill of the lab personnel. This may lead to inter-laboratory variability and inconsistent results.
Next, I want to continue the clinical applications of plasma thrombin block technique. First, for FNAC tumors, this method helps convert the residual aspirate into a clot, which preserves important tissue for histology. With this method, we can observe better architectural patterns such as acini and cohesive clusters. It also supports reliable immunohistochemistry. Besides that, this technique reduces the need for repeat aspirations because preserved clot can be used for additional tests. This is very helpful for molecular assays, including targeted therapy analysis like EGFR testing for lung cancer. Next, for serous fluids such as pleural or acidic effusions, plasma thrombin blocks will concentrate the sparse malignant cells, making it easier to detect malignancy. It also improves ability to differentiate between mesothelial cells and carcinoma cells using immunohistochemistry. This technique also preserves DNA and RNA, which is important for molecular testing in efficient samples. Next, for future improvement, including using standardized pool plasma when patient plasma is not enough, maintaining a fixed plasma thrombin ratio, and improve reproducibility. Enhancing DNA and RNA preservations will support advanced techniques such as next-generation sequencing. Lastly, the conclusion is the plasma thrombin method remains one of the most widely used and reliable techniques for preparing cell blocks. It is favored because it is simple, low cost, and works well with many types of cytology specimens. These methods also provide us good morphology and adequate cellularity, allowing the process block to be used for diagnosis as well as immunohistochemistry. Another strength is its efficiency. The clots form within minutes, making it suitable for a lab with high workload. However, there are important limitations such as using expired plasma can lead to inconsistent clot formations, uneven cell distributions, and fragile pellets. Finally, expired plasma contain amplifiable DNA, which increase the risk of contaminations and may affect the accuracy of molecular testing.